asking community leaders where they want to be next. I think because there's what we call health systems resilience, which is obviously the ability for the system to really take back the shape. But do we want that normal? People could actually we need to leverage these community leadership to get to another new normal, which I think could be much better because we have community voices that are there and we need to listen. I think that's a function that I feel like we need to amplify. So how do we listen to community voices and eventually follow them? Because sometimes we listen to them, then we say thank you. How do we even say we listen to you and we are ready to be informed by you, and we incorporate into policies? So I think that would be a strategy for us to get there. So we have been guided by the scientists, which is amazing, but we have seen the power of community health workers. So we need a community-informed science to guide us at this point, because they have been effective in getting these resources to the poor. They have been the champion in fighting and implementing equity-driven solutions. So why can't we then have a community-informed science moving forward? And that will help us to get to another normal that I think will help us to deal with the pandemic we have now, but also the future pandemics. We need a community-informed science. We need a community-informed movement that is going to drive and define what the normal we want from now on.